A 17-year-old Florida girl collapses and dies while competing in track and field. She's the third high school athlete to die this week. It all began with the tragic death of basketball player Wes Leonard from Michigan. It grabbed national headlines, but it also got the attention of parents in Western Pennsylvania, wondering tonight if their kids are at risk. A high school basketball star collapses from an enlarged heart. A 17-year-old rugby player, a victim of sudden cardiac arrest. A teen track star collapses in competition. All three died this week.
1 in 28,000.
This may seem like a small number at first glance.
However, this is the average number of young athletes aged 12 to 35 which die from sudden cardiac death every year.
Between 2004 and 2008, sudden cardiac death claimed the lives of 45 student athletes between the ages of 17 and 23 in the NCAA.
The saddest part is these deaths had the potential to be prevented.
Their underlying cardiac abnormality may have been detected had they been properly screened with a 12-lead electrocardiogram.
Everyone knows their age, height, and eye color.
Many even know their blood type.
But what do people know about the most important muscle in their body?
Your
heart.
Do you know what your eye color is?
Brown, but it's kind of greenish.
Brown.
Blue.
Is that hazel? Do you know what your blood type is?
A negative.
Oh. Have you ever had your blood pressure taken?
Yes.
Yeah.
Like 3 days ago, it was like 85 or 60.
Do you have any underlying cardiac conditions such as wrong QT syndrome?
I don't think so.
I'd say liver check.
I have no idea what that is.
Do you know what an ECG is?
No, I don't. I've heard it on Grey's Anatomy, but I don't know what it means.
Few people are aware of their personal cardiac function and whether or not it is considered healthy. The public has been given the notion that athletes, especially those who are young, are physically fit and able to tolerate the extremes of physical exertion. Unfortunately, this is not always the case. In athletes under the age of 25, congenital underlying cardiac abnormalities are the leading cause of sudden cardiac death. This includes long QT syndrome, catecholamine polymorphic ventricular tachycardia, and hypertrophic cardiomyopathy, or HCM, to name a few.
As an example, let's take a closer look at the leading cause of sudden cardiac death, hypertrophic cardiomyopathy. This presents as a thickening of the muscular walls in the heart as seen here. This decreases the chamber volume, which decreases the amount of blood the heart is able to pump out per beat. During exercise, the increase in demand for oxygenated blood forces this hypertrophied heart to work harder than a normal heart. The increase in heart rate, combined with an increase in muscle tissue, favors the onset of ventricular fibrillation. Without immediate medical attention, ventricular fibrillation is often fatal.
One method by which these underlying cardiac conditions can be diagnosed is through the use of a 12-lead electrocardiogram. A 12-lead electrocardiogram utilizes 9 electrodes placed at specific points on the body. There are 6 chest electrodes, as seen here, and 3 limb electrodes. The combination of these 9 electrodes picks up the electrical signals emitted from the heart. Although not 100% perfect, an electrocardiogram has been shown to accurately diagnose hypertrophic cardiomyopathy up to 94% of the time, and elongated QT syndrome up to 96% of the time. Pre-participation screening of athletes is not a new concept. In fact, Italy has had a mandated pre-participation screening of athletes for the last 25 years.
Current protocol in North America dictates that athletes undergo a patient history as well as a physical exam prior to participation. In Italy, we have shown a 90% reduction rate in sudden cardiac death through the implementation of a 12-lead ECG pre-participation.
The most common cause of sudden cardiac death in young athletes under the age of 25 is hypertrophic cardiomyopathy, accounting for 36% of all cases. Over the 25 years of the Italian study, there was a 50% decline in HCM-related deaths in all people under the age of 25.
In fact, countries like Australia have recently begun large trials testing the efficacy of these pre-participation screening of athletes to see if they'll work for people in their countries as well. The world is taking notice, and you should too. If you're the 1 in 28,000, wouldn't you want to know?
If a positive ECG test is detected for a cardiac abnormality, your doctor may recommend some follow-up tests to rule out false positives. These may include an echocardiograph, 24-hour ECG monitoring, stress tests and/or exercise protocols. These tests will ideally aid in correctly diagnosing the exact cardiac abnormality that is present.
By identifying any cardiac abnormalities that you may have, you can better understand the risks involved with your athletic activities. You can then take precautionary measures towards living with these conditions, such as limiting strenuous activity or taking pharmaceuticals such as beta blockers. Your heart is arguably the most important muscle in your body. Get to know it better by getting properly screened for cardiac abnormalities before partaking in athletic activities. The benefit may be saving your own life.
Overall, SCD may be preventable if the right measures are taken. The simple addition of a 12-lead ECG to your regular physical may help to identify a cardiac abnormality before it manifests itself as sudden cardiac death. Head to your local walk-in clinic. Ask if they have an ECG and a cardiologist on staff. If not, they may be able to refer to you to a center which does. Your health is in your hands now. Take care of it.
I think about Michael all the time. It just comes to mind. I remember his charming smile and how we first met. We dated for almost a year before it happened. He played basketball every night. And one night he just collapsed after taking his last shot. I thought he'd be okay, but he's dead. I've cried a lot, but I can't shake the feeling that somehow it could have been prevented.
Sudden cardiac death.
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 If you were 1 in 28,000.
Wouldn't you want to know?